Xarelto was a new drug approved in 2011 for the prevention of stroke in patients with atrial fibrillation. It is part of a new class of drugs called new oral anticoagulants. Xarelto claims to provide an improvement upon the standard therapy for atrial fibrillation for the last 50 years. A drug called warfarin, also known as Xarelto, was a new drug approved in 2011 for the prevention of stroke in patients with atrial fibrillation. It is part of a new class of drugs called new oral anticoagulants. Xarelto claims to provide an improvement upon the standard therapy for atrial fibrillation for the last 50 years. A drug called warfarin, also known as Calmiton. At first blush, Xarelto appears to be equally effective as warfarin at preventing strokes. However, because it is a blood thinner, it also greatly increases your risk of experiencing a major bleeding event. But there is hope, and that is it's possible to significantly reduce your risk of suffering a major bleed while on Xarelto. It's a simple blood test. Warfarin patients have undergone this blood test for decades in an effort to reduce the risk of a major bleeding event. Unlike warfarin, the makers of Xarelto, the drug companies of Bayer and Janssen have claimed in their advertisements and other promotional materials that Xarelto patients don't need to have their blood tested. They claimed this is an advantage over warfarin therapy, and that not needing a blood test justifies them charging Xarelto patients almost 10 times more than warfarin patients. This claim is simply not true. Recent publications indicate that if patients on these new drugs, including Xarelto, were to simply have their blood tested and then have their dose adjusted based on the results of that blood test, that their risk of a major bleed could be reduced by as much as 20 to 40%. This information has not been shared with doctors or patients. If you or a loved one have experienced this serious or fatal bleeding event while on Xar